safety measures Gknm hospital had taken with regards to COVID-19 pandemic. We request patients to come with previous scheduled appointment to avoid overcrowding. Patients and doctors are allowed through separate entrances after screening at the entry level. Patients and attenders are advised soap and water hand washing at the entry point. Medical masks are provided before entering the hospital. At the screening area, patients and attenders are advised to maintain social distancing of at least 1 meter. At the screening area, patients and attenders are screened with the questionnaire in accordance to Ministry of Health and Family Welfare COVID screening criteria. Their body temperature is scanned with the thermoscanner. Patients and attenders are asked to sanitize their hands with alcohol-based hand sanitizer. Only one attender will be allowed to accompany with the patient to avoid overcrowding. Inside the OPD block, we ensure that proper social distancing is maintained in the waiting area, registration counter and laboratory section. Signatories on respiratory etiquettes and hand hygiene are kept in most of the areas. Inside the OPD consulting room, the doctor wears appropriate PPE to see their patients to ensure both healthcare workers' safety and patient safety. At the screening area, if the patient fits in with the COVID suspect criteria, are directed to the flu clinic. Flu clinic has a separate entry, adequate ventilation and unidirectional flow of patients. Separate doctors with full PPE evaluate the patient clinically. If they fit in with the possible COVID suspect and needs admission, they take appropriate respiratory swabs in the designated areas. The patient is shifted then to the isolation ward. In the isolation facility with single rooms, patients are taken care with full PPE. If the test result is negative, the patient will be shifted to the normal ward. Periodic cleaning of floors, frequently touched surfaces, OPD areas, lifts and vehicles are done as per guidelines. Patient safety and healthcare worker safety are our main priority. Individual responsibility from patient side to avoid overcrowding and to maintain personal hygiene is important. 4 pillars to prevent COVID-19. Social distancing, personal hygiene including hand hygiene, respiratory etiquettes, appropriate face cover, mask. Gknm Memorial Hospital. We care and it shows.